Hey, Dr. Birchler here. One of the common complaints I see after somebody has a car crash that is a little bit less common, people may be unaware of, is shoulder pain and actually misalignment of the shoulder itself. So most people are familiar with the idea of whiplash. You get a hit and your spine has this whipping motion, and people will often get neck pain, and you see the movies and things where people wear the neck brace and these kind of things. There's a time and a place for that. But people are familiar with that concept of whiplash. And I think most people get that if you have neck pain or trauma, you can get headaches with that as well. Maybe not everybody recognizes that the headaches are associated with the neck, but the huge majority of people that are having headache syndromes, there's a problem in their spine that's causing that. They feel pain in the head, but it's the way the body is wired. They're getting a pain syndrome that they perceive in the head, even though the problem is actually in the neck. Now, there are certainly other reasons for headaches, but I would say, my experience, certainly the huge majority of headache cases tie into the spine. My point here with the shoulder injury is, let's imagine somebody's going to be in a head-on collision, and change the angle of this. So if I'm sitting in my driving and I have a seatbelt on, that seatbelt, it was called a 3-point harness. It's not like the race car drivers with a 5-point harness that comes across both shoulders and buckles on the chest. Our cars have a 3-point harness, so it comes across one shoulder and buckles at your hip, so one shoulder is supported, the other one's not. And if I have a head-on collision, my body is going to whip and it's going to rotate because that seatbelt strap is going to lock here and kind of support the one side, but the other side, the momentum or inertia of the crash is going to continue. And so you'll get this rotation of the spine in addition just to the forward whipping of the spine. And commonly for the driver, that seatbelt is going to come across their left shoulder and buckle at their right hip, but their right shoulder is free, and so they'll get this rotation movement, and their shoulder may actually misalign a bit in the socket, and they can get some impingement type of problems in addition to the neck and then the upper back with this whipping and twisting motion that happens. So people very, very commonly after a car crash will, in addition to their neck pain, will have pain in their upper back and in by their shoulder blade, and oftentimes shoulder pain as well. Shoulder pain is also commonly a referred problem, pain syndrome from the neck, and there's no shoulder problem. However, in these auto cases, there's clearly a mechanism of injury, and a lot of times people have some level of independent shoulder misalignment that leads to an impingement and pain, and so they really need their spine checked. They need their shoulder checked. If there's any element of hitting the dash, they may have wrist or elbow type of trauma too, even just from the steering wheel. Just gripping the steering wheel can cause a force to go up through the neck, shoulder, elbow, and wrist. And these are things that oftentimes they just kind of get missed. Nobody ever really does anything with these, but a good chiropractor will be able to check the spine, also check these other joints, and really help the person get is completely better from that chain of trauma that occurs as possible. If this is an issue for you, ongoing shoulder pain, elbow pain, wrist pain, pain in between the shoulder blades, or that kind of thing there, get yourself to a good chiropractor who's familiar with treating auto accident injuries. If you're in our area here, Beaver County, Pennsylvania area, we'd certainly love to talk with you and see what we can do to help you. But thanks for watching. I hope this helps.